Hi, again, my name is Mary Brower. My sons Theodore Tiller, also known as Teddy or Ted Tiller, and Daniel Tiller come here since they were small. I've been coming probably about 20 years. I've probably been a member for about 18. And as many of you know, my son Ted has undergone some medical difficulties in the last couple of years. When your child gets sick, your world stands still. Your whole focus is on getting them well. You are the center of a tornado, a vortex. Everything continues spinning around you. You work, your family, your bills, but you can't focus on these things. You can only focus on what gets them well. Tornadoes hit unexpectedly. You may have some preparations in place, but you're never fully prepared. To my benefit, thanks to Snook, I had attended Pulse's course on patient safety advocacy, where I learned some of the skills that were invaluable in dealing with the medical system. Thanks to this class, I carried my son Ted's medical records with me to the emergency room in a Pulse tote from one of the seminars, and was able to give the doctors who were totally unfamiliar with his rare disease some information on his disease, all the doctors' names and phone numbers for them to call, and learned about his special needs. I carried forward test results, EKGs, and drugs, a list of drugs that were not permitted because they would jeopardize his care with this disease. I carried a notebook to record his medications and new test data, and took advantage of the antibacterial wipes to keep his room and equipment free of bacteria. Despite all these preparations, Ted came to the hospital with a probable aspiration pneumonia and then had 2 other infections while he was there that sapped his strength and delayed his recovery. It was members of this congregation, Kyle and Eileen, who helped me get Ted to the emergency room that day. I was just coming off a bad cold Christmas week, and Ted showed signs of getting the bug the following week. He was lethargic for 2 days, and then on the 3rd day ran a low-grade temperature. Luckily, when I got home from work that day, I sat with him. He was sleepy, and I just happened to catch a glimpse of his nails, and they looked like they might have a blue tinge to them. But I was a little confused because his hands were warm. I called Kyle, who's an EMT, and Kyle said we better get him to the hospital. Kyle came to my house to help me get him to the hospital of my choice, as opposed to calling the ambulance. And Eileen met us there. Ted was admitted and within a few hours was intubated and attached to a ventilator machine. Lori Bellafiore, who works at the hospital, came up to the room to check on us just as a crew of people arrived to force the ventilating tube down Ted's throat. Lori was a great comfort as she continued to visit me almost daily and give me a break to either take lunch or take a nap. I slept at the hospital as well as the rehab facility every night since Ted was admitted December 29th. He's still in a rehab facility, but we're working to bring him home soon with the tracheotomy, the ventilator, and a feeding tube. The majority of medical personnel mean well and do their job well, but because of the specialization of their roles, staff shortages, breakdowns in communication, and lack of continuity of who they are assigned to, there's no consistency in care. There were numerous serious issues and concerns that transpired during his stay, such as an adverse reaction to medication, being given medication he wasn't supposed to get, and lack of hand hygiene, which can spread disease. I would have to say that between the hospital and the rehab center, there have probably been a dozen incidences or more affecting his recovery and or safety, and as many as 3 in one day. An unintended but very real result of having someone as sick as Ted and a family is the effect it's had on his younger brother, Daniel. Between working my job and attending to Ted's growing neediness, Daniel's needs have often been left on the back burner. He's in the unenviable position of watching his brother deteriorate and wondering if the disease will hit him. It's a genetic disease that we didn't know we had in the family. He has not received the attention he deserves from me during this. To this end, my family and I have been very blessed to be part of this congregation. This community has watched my children grow, supported, and nurtured us. As soon as people became aware of our situation, we had help coordinating visitors and keeping people posted. Our wonderful friends here at Snook had visited, watched Ted while I took a break, or got a meal, or shared a meal with someone. Ted has received cards and notes that he reads and knows that he's cared about. The bullies learned their lesson, the book Ted wrote and had published, all with the help of Snook friends, was displayed. Eileen brought it for a display in his room, and he sold 4 copies in the hospital. I also brought in the wonderful quilt that Lisa Belillo put together that was made at the fundraiser for the United Mitochondrial Disease Foundation last February, with little sayings on each of the squares. And Ted, even before he went to the hospital, would like to take it and finger it and read the sayings over and over again. And people would come in and admire it. Ted likes to reread and reread the wonderful things people wrote for him. His rehab room is covered with the cards, balloons, gifts the people from our congregation of Broader sent. Our minister, Catherine Torpy, has visited both Ted and me on numerous occasions. Not only have people expressed their concern for Ted, but also for me and my well-being, urging me to take care of myself too. We've had numerous visitors. While we were at the hospital, though, a little side story, we were visited by the hospital chaplain. She came the first day and gave me her business card, and of course I was in the middle of the vortex, so I stuck it in my pocket. I never looked at it. When she came back later in the week, she introduced herself again as a chaplain. Thinking she was of the Catholic faith, I said, I have to tell you, I'm a Unitarian Universalist. She said, so am I. I belong to the Shelter Rock congregation. Turns out that she had met Ted 2 weeks early at a musical service held there, that Ken Schneider, who's been helping me with Ted, had taken him to. She had bought his book, and when she saw it displayed in the hospital room, knew exactly who he was when she'd come through earlier in the week. All of this care, concern, and support is very appreciated and is also part of the advocacy services encouraged by Pulse for safe, quality care and to promote good outcomes on patients. This support, part of the family-centered patient advocacy services being taught here at Snook by Pulse, is one of the things I believe helped me through this and a good reason to be celebrating Patient Safety Awareness Week. Looking back over it, I don't know how people survive this type of crisis alone. We are very thankful and feel very blessed to have all of you in our corner. We want to thank you again. I want to express my special thanks to Eileen Karina and Kyle Schussler, not just for all their recent help, but supporting me and Daniel through the last 2 years of Ted's illness and being there for Ted every minute they could. Thank you so much.